Hey guys, today's topic is dysentery. Dysentery is inflammation of colon characterized by severe bloody diarrhea and abdominal pain, which is caused by organism Escherichia coli and Shigella, and the incubation period is 1 to 3 days. Dysentery can be transmitted by contaminated food, and food gets mostly contaminated by flies and cockroaches when maintained poor food hygiene. Contact with contaminated water and other type of drink, and direct contact with infected person. Following are the risk factor of dysentery: poor excreta sanitation, poor water sanitation, poor food hygiene, and poor personal hygiene. Now let's see what are the causes of dysentery. Dysentery is caused by drinking contaminated water or swimming in contaminated water, sexual contact with infected person, especially oral sex and anal sex, using contaminated toilet and touching mouth without washing hands, eating contaminated fruits and vegetables without proper washing. Now let's begin with the disease process. Because of all causative factors, bacteria enters in body, tackles acidic pH of stomach and gains entry in colon where they multiply. While multiplying, this bacteria produces toxin which causes damage to inner lining of colon. As a result, there will be bleeding and inflammation of colon. Thus, fluid present in the tissues of colon is leaked in bowel. As a result, there will be decreased absorption capacity of intestine, which causes severe bloody watery diarrhea. Following are the signs and symptoms seen in dysentery: fatigue, fever, nausea, vomiting, loss of appetite, abdominal pain and cramps, flatulence, loose watery stool mixed with blood and mucus, dehydration, weight loss, weakness. If not taken proper treatment, causes complications like hypotension, that is decrease in BP, convulsions, coma, death. Management include antibiotics, antiemetics and antidiarrheal drugs are given for patient. Patient is kept nil by mouth till vomiting and diarrhea is reduced. IV fluid can be given to maintain fluid balance. Now let's see what are the home management of dysentery. Drinking plenty of water to maintain hydration, drinking ORS to maintain electrolyte balance, black tea without sugar will help in reduction of intestinal inflammation. Lemon juice. Lemon has antimicrobial properties which helps to kill the bacteria and reduces symptoms associated with dysentery. Orange juice. Orange has anti-inflammatory properties which helps in reduction of intestinal inflammation. Buttermilk with rock salt. Buttermilk is probiotic that promotes digestion, and rock salt helps in reduction of inflammation. Raw papaya. It helps in reduction stomach cramp. Preventive measures: proper excreta and water sanitation, maintaining good personal hygiene and food hygiene, fly control, washing hands thoroughly before and after food and after using toilet, wash fruits and vegetables properly, isolate the infected person.